Good morning, everyone, and welcome to our webinar, Double the Impact, GTL's Precision Care Cancer Coverage, with AIM's Mike Anderson and GTL's Greg Esposito. Today's webinar will be recorded and then later posted on our website. This does mean that all attendees will be automatically muted so that we get a quality recording. If you have any questions, go ahead and type them into the chat box, and we'll try to answer them throughout the presentation. But if we're unable to get to all the questions, we'll have a member of our marketing team reach out to you individually to make sure you get that answered. Before we get started, we'd like to invite you to join us for our next webinar on Tuesday, June 17th at 9 a.m. Pacific Time. Join Derek Lape for the Art of Overcoming Objections and De-escalating Situations by registering at yaim.com/training. And with that, I'll hand it over to Mike so that we can go ahead and get started. Take it away, Mike.
Thanks, Jordan. As always, we appreciate everything you do to help pull all this stuff together. Jordan is crucial behind the scenes as far as putting the invitations together and the technical stuff. So it's a key piece of what we do. Good morning, everybody. Appreciate you making your time available. I know there's a lot going on in the senior health space right now. The AHIP stuff is running up, turbulence with regard to meds up pricing and things like that. And that's a big reason why we wanted to talk about a lot of emphasis on the precision care, but about this dynamic duo that Guarantee Trust Life has made available for us. Joining me today, and we're greatly appreciative of his time, is Greg Esposito, the Assistant VP of Sales. And despite what everybody thinks, he is not an Elon Musk clone. And actually, we think that maybe Elon is getting asked as he's moving about in the public space whether he's in fact Greg Esposito. So Greg and I are going to spend some time talking to you about all this different kind of stuff, and the emphasis that we're placing, and this is the beginning of a program that's going to be going on for several weeks now, is can't do anything about the turbulence in the marketplace, but what you can do is take steps to make sure that your clients are better taken care of, that they have the things that they need, and that the value you bring, what's called the value proposition score, that particular thing for you as agents is as high as possible, so that when something happens, they know that, hey, we don't have to worry. Our agent has taken care of us. They're going to continue to take care of us. They will have a solution for this rate situation or this carrier situation. So with all that aside, Greg, I'm going to go ahead and turn it over to you, and we will get the party started. Thank you.
Hey, sounds good, Mike. Appreciate it. And yeah, these are two great products to chat with your clients about. These are also two products that are very, very difficult phone calls to get from clients. We all know clients are going to call us when they need this coverage, but unfortunately, they find out they need it after they've had some type of cancer diagnosis, or in the short-term care arena, they find out that they're going to need some type of care, especially home health care. So it's a very difficult call to get a call from your client and say, hey, I need some cancer coverage. I just got diagnosed, or I have a feeling I'm sick, or that's the tough call. So as difficult as it may feel to bring up a cancer product to a client to kind of take their temperature to see if this is something that they'd be interested in, I think that's a lot easier to do than to get that phone call when it's too late to be able to help them. And these two products today are just perfect for those scenarios. These are products that most people, if they are made aware of them, will actually purchase. The cancer sale, to give you an idea, we all know that everybody should probably have some type of cancer coverage. We've all probably had folks that, whether they're relatives or coworkers, friends, been diagnosed with cancer. And it doesn't seem to matter if you're underage, overage, meaning senior market, or not yet in the senior market. It doesn't seem to matter. If you get diagnosed, there's going to be out-of-pocket expenses, and whether that means maybe you've got a Medicare Advantage plan and you've got that maximum out of pocket that you're going to hit if you get cancer and start getting radiation or chemo. That's usually an 80-20 copay. you're going to hit that. And, or if you're underage, maybe you're going to have to take some time off work. You're going to blow through your vacation time. You're going to need some extra money in your bank account that a cancer plan from GTL would provide. To give you an idea on the short-term care side, this is an area that, boy, there's a lot of folks that don't even know about long-term care. Usually by the time they find out about it, they are at a point where they may be a little bit older and the premium for it would be just super high, too expensive for them, or they're at an age where health-wise they're just not going to be able to qualify for a long-term care plan. So these short-term care plans that are out and about today in the market, I generally see kind of two different kinds. There's one like our short-term home health care plan that we can chat a little bit about today. This is a very simple product to get. And by simple, I mean 3 application questions. Basically, if you're not getting home health care now, if you don't already have an issue doing your ADLs, and you've not been diagnosed with a cognitive impairment, memory loss, you can get these products. And because of the way that GTL built ours with a prescription drug benefit, the net cost can be anywhere from $5 to $10 a month. And then you've got all this home health care aid, benefits waiting for you should you need it down the road. And this is a product that most of the time when the agents bring it up, the clients buy it. The issue is that sometimes the agents just don't bring it up, the clients don't know about it, and then when they need it, they can't get it. So, with regard to the products we're kind of chatting about today, and we're taking a little bit of a looser format today as opposed to just a straight big PowerPoint presentation on it. These are products that GTL excels in. I should probably tell you, if you're not familiar with GTL, full name's Guaranteed Trust Life Insurance Company. I always use the acronym GTL. One simple reason: we don't want to confuse clients. Our products, especially the ones we're chatting about today, are health products. So when we say Guaranteed Trust Life Insurance Company, kind of can confuse clients thinking that these are life products when they're actually health chassis products. So GTL is an acronym. I really like that. Been around since 1936, super solid company. What we do is we create ancillary products just like we're talking about today. I like to call them complementary because usually a client's going to have their main health insurance, whether it's an ACA product or a Medicare product. And when they use them and they're going to have co-pays, we usually have products that are great to take care of those. The key thing is just letting the clients know about them so they can get them before they have those situations come up. GTL is super well rated by AM Best, A, excellent. And I think 2024 was our 14th consecutive record year in a row for sales. So if you are already selling GTL, we want to thank you for that. A couple things that are good to know about the products we're chatting about today, both the cancer plan and the short-term home health care plan. There's no requirement to have any other type of insurance in order to apply for these coverages. And by no means am I ever suggesting that these 2 products would be all your client would need as healthcare insurance. But sometimes agents feel like, well, can my client apply for that if they don't have this type of coverage? We get that with hospital indemnity a lot. Can my client apply for a hospital indemnity plan without a Medicare Advantage plan? Well, sure, they can. And the same goes with our cancer plan and short-term home health care plan. Something else that I like to just get out right away when it comes to any GTL product, GTL is going to pay claim benefits based upon a GTL coverage. So at no point do we sit and say, well, we got a claim in here that we're supposed to pay the client $3,000, but they have this other insurance and their copay is only $2,000. So let's knock that down. We don't do that. We don't really know what other type of insurance the client has. So we always pay claim benefits based upon their GTL coverage. So I think that's important, to know right from the get-go when it comes to these types of plans. So something else that's good to know, especially when it comes to these 2 plans we're chatting about, and really special highlight on the short-term home health care plan. GTL likes to create very short, 2-minute-ish videos that will really help you get the cross-sale started. And that's kind of one of the focal points that we want to talk about today is how do we get the cross-sale started for both a cancer plan and a short-term home health care plan. But it's good to know that you should really lean on the short-term home health care video. You can also lean on the not only the Precision Care Cancer Plan video, but also the fact that we have a website set up specifically just for this product. So if both you or your client want to go to outsmartmycancer.com, you've got the video waiting for you and a bunch of other information sitting there waiting for you. In terms of getting business to GTL, we don't get a ton of paper applications anymore, but we actually do still take paper applications. But about 90% of our business still is coming in via our e-app platforms. And to give you a little bit of an idea, what I suggest, if you're going to meet with the client face-to-face, download GTL e-app onto your tablet or your smartphone. Then you can do a quote, you can do an e-app. When it's time for them to sign on the dotted line, they go ahead and sign your device screen, and you're good to go. Now, if you're not with the client, you just go to GTL's website, gtlic.com, and you can log in, the same login that you set up for your e-app platform on your tablet or smartphone, just keeping it simple. And then you can do the same e-app. And when it's time for the client to sign on the dotted line, you just put their mobile phone number into the website application. It shoots them a text with a 5-digit code. They give you the code, you put it in the app, you're done. So getting the business to GTL is super, super simple. In terms of cancer coverage, let's just kind of start there. And Mike, if you want to interrupt anytime, just feel free. But talking to agents over the years, what's the best way to start a cancer cross sale? Well, I always like to keep it simple, and I like to just start off with one sentence, and it's really simple. Let's just say we're talking to Mr. and Mrs. Smith. Mr. and Mrs. Smith, what company is your cancer policy with? It's not super invasive. It's not uncomfortable. And the thing I love about this is you're not only asking them if they've got cancer coverage, you're almost inferring that they should have it, which I think pretty much everyone believes that, people should have some cancer coverage. And I always kind of like to play out this conversation a couple different ways. So, how could Mr. and Mrs. Smith respond here? They're probably going to say, well, we don't have one. Or why do we need one? Isn't this Medicare Advantage coverage going to take care of us? Or isn't this, Medicare AB with MedSup? Or isn't my ACA plan going to take care of this? Whatever it is, they may come back and say, I thought we had coverage. Why do we need a specialized policy? And at this point, this is where I differ a little bit from some folks in the industry. This is a point where you got a little bit of an objection. You might tend to go down the statistic route and say something like, well, Mr. and Mrs. Smith, you do know that 1 in 2 men and 1 in 3 women may be diagnosed with cancer. And I'm not a big fan of that because I think in the client's mind, they're probably going to think, well, you know what, I'm just hoping it won't happen to me. And so that's not a great way to handle the objection. So what I like to do is just kind of share my personal story, and you should share yours. We all got one, and I'm sure all of you have friends or family that have been diagnosed with cancer in the last couple of years. So, I kind of put mine up on the screen here. Just, in the last couple of years, I've had 3 of my close friends, relatives, diagnosed with cancer. And, unfortunately, it didn't seem to matter if they were seniors or underage. They still had a lot of money out of pocket, even though they had insurance. So at that point, what would Mr. and Mrs. Smith say? Well, they might still do that. Well, I just hope it doesn't happen to me. They might say something like, well, we already got enough insurance premium costs. So what do we do from there? And that's one of the beauties of this Precision Care Cancer Plan is it does offer a return of premium option. So at this point, you can handle that objection just by saying, well, what if I showed you an affordable cancer plan that if you needed it, you could get up to $50,000, but if you didn't need it, you could get your money back. That's an actual objection. It's just hard to combat, come back from that in terms of Mr. and Mrs. Smith, what they would say. Most likely they're going to say, like, is that even possible? Most people don't know about a return of premium option. So the beauty of the situation here is we've got a plan at GTL that you can do that. Now, let's just say that, you're thinking, boy, Greg, that's not too bad. I could do that. What company's your cancer policy with? Sounds like it's going to work every time. Well, here's a little bit different scenario of how this conversation could go. What if you started out with what company's your cancer policy with, and your client came back with, oh yeah, we've got a cancer policy with ABC Insurance Company. And you're like, oh man, Greg didn't tell me about this. Oh yeah, here we go. We're going to go ahead and see how this conversation can go. So what do we want to do? We'll definitely want to, just let them know that that's great that they have a cancer policy already. And probably ask them how long ago they've had it. That actually makes quite a big difference. I can tell you in my personal scenario, I found out a couple years ago when my dad was diagnosed with lung cancer, thankfully caught really early and he's fine. But that's when I found out that he had a cancer policy, and found out that that policy was like 25 years old and basically was an old schedule of benefits policy that no inflation rider. So, it was kind of like, at the end of the day, with all the stuff that he went through in treatments, it might have gave him $250. So it does kind of matter to ask about what kind of policy they have. But for the most part, if they got a policy and it was maybe 4 or 5 years old, it's probably a lump sum type of policy, and that's great. So if they say they got it 5 years ago, that's great. Where do we go from here? Well, we still want to make sure they have the best chance of beating cancer. So that gives you a prime opportunity to introduce them to GTL's Precision Care Cancer Plan. So you could respond and say, yeah, these policies, I'm glad you have them. They don't really expire unless you stop paying the premium, but I should make sure that your policy has the latest genomic sequencing benefit. Now, how would they respond to that? Probably going to be like a what-genomic benefit? Because unless you've been diagnosed or worked with somebody who's, closely, who's had cancer and gone through all that stuff that happens after you get diagnosed, they probably don't know what genomic sequencing is. And so basically, you don't want to get too deep into the weeds here, but we're basically telling them, genomic sequencing is the latest testing that's going to tell your doctor the exact type of cancer you have and also the best way to treat that. That's a really expensive test. However, we've got a product, a cancer product at GTL, that not only gives you that big chunk of money when you get diagnosed with cancer, but it also cuts a second check and pays for that genomic sequencing testing for you. So think of it this way. When you talk about GTL's Precision Care Cancer Plan, it doesn't matter if you're working with the best cancer doctor in the world or the good cancer doctor. When you start working with Precision Care and you have the genomic sequencing done by TGen, who's the lab that we have do this genomic sequencing, and their doctors, now your client, wherever they live, they're working with the best. So this Precision Care Cancer Plan is really designed to help the client not only take care of those out-of-pocket expenses, but also it's meant to help them beat cancer. So we talk about it as being the next generation of cancer insurance. So let's just keep it simple. This is a lump sum cancer plan, and the genomic sequencing that is paid for by GTL is taken care of by TGen, which is the leading genomic sequencing laboratory, and actually they're based out of Phoenix, Arizona. Give you an idea of where the Precision Care Cancer Plan is approved. We're looking at the states that are currently on your screen. Now, we've had this plan since 2016, so I do not anticipate more states coming on unless those states kind of change their regulations with regard to allowing cancer coverage. So we can take a quick view of the video here that's available on this plan to give you an idea a little bit more about what genomic sequencing is about.
This is your DNA. With a diameter of only 2 billionths of a meter, this unfathomably small molecule controls everything that makes you, you. From your individual cells to your physical appearance, to even how your body reacts to cancer. Everything about you is determined by your unique genetic code. Due to the incredible complexity of your genetic makeup, you have heard that prescription drugs or exercise plans may not always work the same for you as they do for others. So then why would treating cancer be any different? Guaranteed Trust Life Insurance Company has partnered with TGen, the Translational Genomics Research Institute, a nonprofit pioneer in genome sequencing and precision cancer treatment. Precision Care Cancer Insurance is designed to help policyholders faced with a cancer diagnosis afford and have access to groundbreaking treatment advancements which may not be covered by other insurance. Precision Care gives policyholders access to TGen's world-class cancer physicians and to TGen's cutting-edge genomic sequencing services, while providing cash to pay for these services and the high costs of today's specialized cancer treatment. Your first shot at treating cancer is your best shot. Place your trust in GTL to help provide what you, specifically you, need along your journey. This is GTL's Precision Care Cancer Insurance. Insurance that's uniquely designed for you.
So, without getting too deep into the weeds about genomic sequencing, what I always like to do is just give a real world example of how this plan works, and I think it works really well. So, back in 2016, when we launched this plan, about 6, 7, 8 months later, one of our sales managers here at GTL was out of the blue diagnosed with stage 3 cancer. And so basically, to be diagnosed, they had to find some type of a lump, a tumor, and they took a biopsy, a little piece of tissue. And that's what they used to take a peek at to see, is this cancer or is it not? And it was. So when it comes to genomic sequencing, the next step after that happens is they take that same biopsy, that piece of tissue. They always take enough just in case they need to look at it again. They send that to TGen in Phoenix. TGen does their genomic sequencing testing on it to determine the exact type of cancer it is. And then also from their vast database, people who had this type of cancer before, how were they treated? Which method of treatment, radiation, chemo, some other drug, some other new drug, what worked best? And then a one-on-one consultation from the doctors at TGen to the policyholder's doctor takes place. And they talk about that stuff. So what ends up happening in the situation with the sales manager, specifically the type of cancer that he was diagnosed with after being genomically sequenced, came back and said, the drug Keytruda, which is an IV, given once every 3 weeks in his example, that's the best way to treat this exact strain of cancer. So the prescription for treatment was basically 3 of those Keytrudas once every 3 weeks, and then surgery to remove the tumors, and then followed up with 15 more Keytruda treatments. And, thankfully, here we are 5, 6 years later, the sales manager is still cancer-free. However, the important part about the genomic sequencing that I really, for me, makes it hit home is also that data that they looked at for how have people been treated with this type of cancer before in the past. That also came back and said, people that got this type of cancer and got radiation or chemo usually passed away between 4 to 6 months later. So genomic sequencing is not only about what's the best way, it also should be able to eliminate, in some cases, what's the worst way? What do we want to avoid in terms of treatment for this specific type of cancer? And that's basically, in a nutshell, what this is basically saying on this slide. So that's the best way that I can try to relay to you what genomic sequencing is. Now, TGen, based in Phoenix, Arizona. You know, we all know that doctors have egos. So you might be thinking to yourself, well, is my doctor really going to care what this lab TGen thinks? So back when we got this product up and rolling, I went to TGen's their website and was able to grab this from one of the videos, which is basically saying, you know, the last couple hundred people that TGen genomically sequenced, and they had that one-on-one consultation with the client's doctor. The doctor said, you know what, 82% of the time, those doctors took the exact recommendation for treatment for their patients. So I think that goes a long way towards showing that, yes, this is a laboratory that is, you know, world-renowned for their research and all the data they have. So very important. Here's a couple of different things to know about this plan. Genomic sequencing has become very popular, so it would not be out of the realm where a client's diagnosed and the hospital immediately wants to do genomic sequencing. So here's something that I really like about the policy. So first off, when your client has this plan and they're diagnosed with cancer, the only thing they have to do is complete the claim form. That's the same thing they would do as if they had some other company's cancer plan without the genomic sequencing option. So they're going to complete the claim form, and they're going to check a box if they want TGen to do their genomic sequencing. And then from there, GTL and TGen will make arrangements to have that biopsy that was already taken sent to TGen in Arizona. They do their work. They have the one-on-one consultation. So it works exactly the same way. The client just has to fill out a claim form. They get their check, and TGen gets their check. They do their work, and they have the consultation with the client's doctor. There's a different way, though, that this can work too. Let's just say your client's diagnosed with cancer, and they immediately get genomically sequenced somewhere else. Well, then they can complete the same claim form, but they'll be checking a little bit different box, basically saying, you know what, I had my genomic sequencing done already somewhere else. And then what GTL is going to do is, instead of cutting a check to TGen, they're going to cut an additional second check for $6,500 and send it to the policyholder to help cover maybe their out-of-pocket costs for the genomic sequencing. So when you have precision care, we're either going to pay for it through TGen, or we're going to send the policyholder both their lump sum check and another $6,500 check. So good things to know with regard to the plan. Now, you definitely, if you have a choice, you definitely want to go with TGen. They actually do a lot more testing than your average laboratory for genomic sequencing, and they've got a lot more data behind them to show best treatment methods. And they're also right on top of the latest and the greatest new type of drugs coming out. So they're just very highly informed. And again, if you're working with TGen, even if your doctor isn't the most highly informed when it comes to cancer treatment, new drugs coming onto the market, TGen is, so you're in really good hands. I won't spend a lot of time on the actual plan itself in terms of what you can get. Basically, you can go $2,500 all the way up to $50,000. You got male, female, and children rates. And again, this would be for that lump sum if you're diagnosed. There's also a cancer in situ benefit of 25%. That's your stage 0 cancer, and also a 25% additional benefit if you happen to take a treatment that is approved by the FDA but still considered experimental treatment. So you get this plan. It's not very expensive. Take a peek at the quotes on your screen. This is a $10,000 precision care policy. My comparison from GTL's previous cancer plan, that was a lump sum cancer plan that did not have the precision care TGen benefits, probably about $2-3 a month more for our newest plan. So you're not paying a ton more for this plan compared to others in order to get this genomic sequencing benefit. It also has a couple nice riders. I like the Benefit Builder rider. This allows you to bump up some coverage, cancer in situ, from 25%, bump it up to 50. It adds a skin cancer benefit of $500. Also adds a wellness benefit. So if you get your annual physical, you get $100 from GTL. And when you take that and kind of compare it to what it costs to add the Cancer Benefit Builder rider, boy, in a lot of instances, it's either paid for or you're just out of pocket a couple dollars a year to add all these new benefits. So the Benefit Builder rider is definitely nice. We talked a little bit earlier about the return of premium rider, where you can get your money back if you don't use the plan. So there's 3 return of premium rider options to choose from. If you're going to say to the client, well, what if I told you about a cancer plan that, if you needed it, it's there, and if you didn't need it, you can get your money back. Well, you want to go with return of premium option number 1, which basically says if you keep the plan for 20 years, you can call GTL up and say, hey, cancel my cancer policy and send me all the premium that I sent you over the last 20 years, less any claims paid. If there's also 2 other return of premium options, you're looking at you could select number 2. If you die before age 86, your beneficiary gets any premium you sent GTL. Or return of premium option number 3, believe it or not, when you die, for whatever reason, doesn't have to be cancer, your beneficiary will get the premiums you sent to GTL less any claims paid. So when you look at this product, this is a cancer plan. This is what we probably can agree most people should have one. Even if it's a $10,000 cancer plan, they should have one. And you got an option to say, hey, you know what? You can add this rider, return a premium rider. So if you don't need it, if you're lucky, if you're that 50%, of female or 33% of males who don't get diagnosed with cancer, you can get your money back. Really a win-win and almost kind of a forced little savings account if they end up not needing this coverage. Underwriting for this plan, just as normal at GTL, it's super simple. You're looking at 5 questions here. You answer them all, no, you get it. Basically, a 5-year look back for internal cancers. Also, you're looking at a height weight chart, pretty liberal. And that's for people going 2,500 up to 15,000. If you're going to get a little bit more, $15,001 up to $25,000, we're going to add an RX check, which, as you know, is just a little behind the scenes check to see what medications are taking. And if you're going higher than 25,000, we're also going to add a short phone call just to verify the meds you're taking and your dosages, and then we'll take a quick peek at your medical history through the medical data. So we're not asking to get medical records. We can get access to them. So really simple underwriting, but again, we see a lot of $10,000 cancer plans. Let me give you a little bit of a tip on why a $10,000 cancer plan is good for your Medicare Advantage clients. We know that your maximum out of pocket on most Medicare Advantage plans somewhere in the $3,500 to $5,000 range. So a $10,000 cancer plan makes a lot of sense, because what if your client has a maximum out of pocket of, let's say, $5,000 on their Medicare Advantage plan, and are diagnosed with cancer, you could say this month, next month, in the fall of this year. Well, and let's say that they're going to have radiation or chemo. On a Medicare Advantage plan, those are generally 80-20 copays. So when you've got that situation, you're going to hit your maximum out of pocket. And if the calendar year turns and you're still getting those treatments, you're going to hit your max out of pocket again. That's why we see if a client has a MOOP of $5,000, let's get them $10,000 of cancer coverage so we can actually make sure we can cover 2 MOOPs maximum out of pockets. Just wanted to show you quickly the questions on the application. You can see we're looking at in the past 5 years, ... Here's the questions below. Here's that website I mentioned earlier, outsmartmycancer.com. You're going to find that video I played. You're also going to find some other information, some infographic information, and a little bit more information on TGen. This is an absolute showstopper of a product. Imagine being in a situation, which you are, where you can not only talk to a client about getting money if they're diagnosed with cancer, but you're also putting them in a great position to have the best folks working on them with their doctor to make sure they get the correct treatment for their cancer. So this is a product nobody else has in this space. And again, that's kind of what we do at GTL. We like to create a plan, whatever space it is, and have some bells and whistles on it that nobody else has. Give you a little bit of an idea. This is one of the infographics that we have. You can order from GTL. You see that red dotted line on the left side of the page? Everything above it is what your standard run-of-the-mill lump sum cancer plan does. You get cancer, you get a check. Everything below that and on the next page is what our precision care plan continues to do. So I kind of like this infographic. It shows a little bit of a variance between your standard lump sum cancer plan and what precision care does. So the cancer plan, that's really a situation where bringing it up is just so important. You don't want to be in a situation where your client calls you and says, I need cancer coverage, because they're always calling you when they already suspect they have a problem, and or maybe they already know they do. And that's tough. So try to keep it very simple and just keep that question very simple. What company is your cancer policy with? And just take it from there. And if you're just if you're sharing your own personal stories, I kind of recommend it. I think that's going to open up the client's mind a little bit more to getting some cancer coverage. And when you run through things like their maximum out of pocket and what their costs may be, that they do have co-pays when it comes to certain types of treatments, radiation, chemo, even some cancer drugs. I think when they look at the cost of a plan like this, they're really going to be thankful that you brought it up and showed it to them. Kind of leads me into the second product today. Yeah, go ahead, Mike.
I just want to jump in as we close out the precision care thing. If you remember when you looked back on the page that kind of introed TGen, you saw down at the bottom, small print, I guess you'd call it, referring to that it's part of City of Hope. One of the incredible things about living in this country is we have a handful, actually, of elite, world-class, best-in-class, et cetera, cancer treatment facilities. Fred Hutch in Seattle, the Mayo Clinic, MD Anderson, Cleveland Clinic. City of Hope is one of those. And the thing that can't be oversold enough about that product is that rather than having to try to figure out a way to thread the needle and get referred to one of these others and making that outreach, et cetera, the setup for that, GTL handles that as part of the claims process. And that first heavy lifting piece with regard to the genomic sequencing gets taken care of when that gets filed. At that point in time, then you have definitive information that you can go forward to whoever it is that you determine that you want to work with. You want to fly to Houston, go to MD Anderson, you come into Seattle to go to Hutch or to Cancer Care Institute, whatever your choice is, that first heavy step gets handled automatically by GTL. So anyway, thanks for that one, Greg. Go ahead and keep going.
Yeah, and you bring up a good point there, Mike. And here's a question I get sometimes from agents when I do like the precision care. They'll say, well, yeah, but couldn't a person just have a regular lump sum cancer policy and then they could go to TGen directly if they got diagnosed and pay for that? And the simple answer to that question is sure, they could. First off, they're going to pay more for the genomic sequencing when they go direct to TGen. We have a negotiated rate. But more importantly, and the only reason I bring it up, when you're diagnosed with cancer, about the last thing you want to do is start researching where can I go get genomically sequenced. And even if you know to go to TGen, trying to make arrangements to get that done, it's just, if you've dealt with being diagnosed with cancer, the world just instantly falls apart, and it's just so stressful. So having this, as you mentioned, Mike, this being automatic is really a big time saver and stress saver for the client. So with that said, this is really an interesting product. The short-term home health care plan, by now, let me just kind of explain what's going on with the color coding. We added more benefits to this plan in 2023 in the fall. we added a ton more benefits. We launched the plan initially in 2018. The states that are in blue have our latest benefits. The states that are not highlighted are still working off our 2018 plan, and Utah is in yellow. That's approved with our new benefits. Our IT department's popping on those benefits onto the website. So those EAP platforms, down the road will be ready to go with the Utah plan. But talking a little bit about short-term home health care. Where's your target market? Well, any of your clients that take a prescription, that's your first target market. And that's going to be most of your clients, right? Basically, most people are taking something. A little bit broader, we got people that, especially in the Medicare, arena, they're it's a little bit too late for them to try and get a long-term care plan, either because of the fact that it's too expensive, or their health is not going to pass the standards that are needed to get a long-term care plan. So this is not long-term care. It's short-term home health care. But boy, it is something that's really nice to have if you don't have a long-term care plan. And we do have some long-term care agents that actually will cross-sell this plan to their clients with a long-term care plan. And they'll have both. Because as you probably know, with long-term care plans, there's an elimination period. Maybe it's 90 days, and in that time period, they could use this short-term home health care plan too. And again, all these benefits, just like we mentioned before, we're paying based upon the GTL coverage. So we're not coordinating coverage and lowering the benefit. So if they're getting more money from GTL than they actually have copays for, hey, that's fine with us. Here's another market you might not have thought of. So you might have some clients in their 40s and 50s that their parents are still alive, but those parents don't have a long-term care plan. So when that type of care is needed down the road, who's going to pay for it? Most likely the kids. Or the kids' time's going to be changed, their jobs, stress is going to change because they may have to rearrange what they do for a living or how they do it for a living to try and help take care of the parents. So we do have situations where, the kids are actually buying and paying for a short-term home health care plan for their parents in the hopes when the parents need the care down the road, it's not going to change the kids' schedule, work setup that much. The fun thing about this plan, it is super simple to get. I mentioned this really early, but what I want to do is just quickly show you the consumer video for one reason. Agents love this video. They say, I play this video for my clients. The clients say, how much is it? And sign me up. So this is a very powerful video to get the cross-sale going. And it's just a great way to go ahead and introduce this type of plan to the clients.
There's no bed like your own. And if you suffer an illness or have an accident, the last thing you would want to do is recover in an unfamiliar, hectic environment like a hospital or nursing home. Focus on your recovery in the comfort of your own home with short-term home health care insurance from Guarantee Trust Life Insurance Company. Think about your family situation. You may be reaching that age where planning for future care is necessary, or maybe your parents are reminding you they don't want to go to a nursing home. How could being unprepared for either yours or your parents' need for care affect your finances and way of life? GTL's short-term home health care insurance is more affordable than most other plan of care policies, and it pays benefits directly to you regardless of any other insurance you have. Home health care benefits kick in if you suffer a cognitive disability or can't perform 2 of the 6 ADLs, and no hospital stay is required. The base plan consists of 3 main components, and there are 3 different base plans for you to choose from to match the level of coverage you want. With the home health care benefit, your chosen plan pays a benefit for up to 360 payments for a variety of services, including skilled nursing, physical therapy, and general nursing care. With our most comprehensive plan, you can receive up to $162,000 of home health care benefits. With the home health care aid benefit, you can receive a daily benefit for each day you require the services of a home health care aid, depending on your chosen plan, and no hospitalization stay is required. Most likely, you're taking at least 1 prescription medication. With the prescription drug benefit, you can receive benefits for any prescriptions that are filled after the policy is in effect. Just filling your normal prescriptions can help offset the cost of the policy itself. Now let's see how it works. Say you're 65 years old, have the Plan A policy, and take one brand name prescription that you refilled 12 times over the year. GTL short-term home health care insurance would pay you a total benefit amount of $300 over those 12 months, with an annual policy premium of $365.68. The net cost of the policy would be less than $6 a month. And this is not even including any home health care benefits you may receive. Policyholders also have access to TCare's concierge caregiver support services and a $3,500 family caregiver benefit. Short-term home health care insurance from GTL is flexible and customizable, with a great set of riders for you to choose from. And with only 2 or 3 underwriting questions, you don't have to worry about a long application process or medical exams. So, for a fair premium, wouldn't you rather receive professional care at home? Now is a great time to find out more about GTL's short-term home health care insurance.
There you go. Really great video, and clients tend to really like it, according to the agents, and does a great job of explaining the product. You can see right now you got 3 plans to choose from, A, B, and C. Talks about how easy it is to get it. So let's see how easy. If you want Plan A or B, you only have to answer the first 3 application questions no. And I'm just going to quickly paraphrase them. Number 1, are you getting home health care right now? Number 2, do you have any issues doing your activities of daily living? You know, your toileting, transferring, eating, bathing, grooming. Number 3, have you already been diagnosed with some type of cognitive impairment, memory loss? That's it. No MIB, nothing else going on behind the scenes. You answer those 3 questions, no, you get it. And if you want Plan C, you also have to answer the 4th question, no. Okay, so let me show you something that's pretty cool about this application. Let me show you what's not on here. Did you just have a heart attack? Did you just have a stroke? Do you currently have cancer? Did you just get out of the hospital? Nothing. So think about that. This is a product that if your client had something happen to them, like a heart attack or a stroke, and they still can answer these questions no, they can get this coverage. I don't know of a lot of products out there that once you have a big health event like that, you could actually still get the coverage. Now, this product does have a 6-month pre-X on it, so if somebody had cancer and they applied for this and got it, they couldn't use it for the first 6 months they have it for home health care due to their cancer, but they could use it for anything else that came up right away after policy issue that wasn't pre-existing. So that's how we can offer this plan to even folks who've had a big health event. There's a 6-month wait to use it for that specific health event. But look how easy it is to get this plan. Now, there's 4 components to this plan, and before I even kind of break it down really quickly for you, issue age, 55 to 85. So this is more of a senior product for sure. But there's 4 components that I want to quickly tell you about. First off, did you catch in the video where it said with the prescription drug benefit, you can use it right away? So you don't have to be on claim for home health care in order to use your prescription drug benefit. So people who are taking prescriptions, every time they fill one that's generic, they get $10 from GTL. Every time they fill a brand name, they get $25 from GTL. How much do they get? Well, if they have Plan A, up to $300 a year, Plan B, $600, Plan C, $900. And as the video did a really good job of explaining, you just fill in your prescriptions as you normally fill them, wherever you go get them, Walgreens, CVS, Rite Aid, wherever it is, you just go get them. And then you let GTL know by sending a copy of your prescription receipt, and then we send you $10 or $25 if it's generic or brand name. It's that simple. So at the end of the day, people buy this policy, and the cool thing they like about it is they actually see benefits from it right away because they're just filling prescriptions, getting money from GTL, and they love it because not only are they seeing value from the policy they brought, but also down the road when they need the home health care, it's sitting there and it's waiting for them. So really some quick questions that we get on the prescription drug benefit. You get 25 bucks every time you fill a brand name prescription? Yeah, you do, until you hit your annual maximum. And then generics work exactly the same way, except it's $10. Now, we got a lot of folks, especially in the senior market, they're doing 90-day supply refills. And I always like to point out to agents that this product is, when you get a refill, you get money. It doesn't matter about the amount of pills in the bottle. So whether it's a monthly supply or 90-day supply, it's one GTL benefit. And also, it doesn't matter if they go to Walgreens, wherever they pick up their prescription. It doesn't matter if they pay nothing for the prescription or they have a $2.50 copay. It doesn't matter. We're still going to send them their $10 or $25. So again, we're not coordinating coverage here. This is an opportunity for them to get some short-term home health care insurance that's really affordable, and then also keep it very, very affordable, maybe $5, $10 net a month after they get their prescription drug benefits from GTL. Now, when they need the coverage down the road, we got some great home health care coverage. Basically, what's going to happen, either they're going to get a cognitive impairment or a functional impairment where they can't do at least 2 of their 6 ADLs. Think of this functional impairment. This is a key point. You know, things like hip replacement, knee replacement, they could come home and need some home health care, and that's just temporary. So they use some or a lot of this product. Then after they recover for 180 days and don't need home health care anymore, they get a full restoration of this 360 days. So I'm just going to show you very quickly, even if they have something where they can't get a restoration, what I do want to show you is even without a restoration, with Plan A, you've got $54,000 of home health care benefits. Plan B, $108,000. Plan C, $162,000. And that basically stems from, with Plan A, you can get a maximum of $150 per day. Plan B, a maximum of $300 per day. And Plan C, $450 per day. So if you take $150 times 360 days of benefits, that's Plan A, that's $54,000. If you take $300, that's the maximum benefit daily for Plan B, times 360 days of benefits, $108,000. Just remember, if they use this a little or a lot, but then they recover for 180 days and don't need home health care anymore, they get a full restoration of those 360 days. So that's component number 2. So you got the prescription drug, then you got the home health care. Those are the first 2 components. Third component is the home health care aid. Probably going to be a home health care aid coming by to help them with their ADLs. Toileting, transferring, grooming, eating, bathing. That's probably what's going to happen. That's a $50 per day benefit for A, 100 max for B, 150 for C. So you've got those benefits there too. And let me show you, let me go right to that home health care aid slide here. And let me show you what else you might want to know about this. Well, first off, no hospitalization is required. You got 360 days of benefits that have nothing to do with the calendar year. So think about that with this plan. You got 360 days of benefits, but it's not tied to the calendar year. Take as long as you want to use these. And here's my point on the home health care aid component. You have up to $18,000 for Plan A, $36,000 for B, $54,000 for C of home health care aid benefits. Think about all these benefits they have. And along the way, they're turning in their prescriptions, so their net cost for this plan is very, very, very small. Same thing. You can get a full restoration on these benefits once you recover for 180 consecutive days. Good to go. So the people that provide this care are going to be professionals. That's your home health care aid. They're professionals working for a long-term care or for a home health care agency, that's licensed and can provide a bill to GTL saying, this is what we did at each session. Keep it simple. So home health care aid provided by licensed professionals. Now that's our third component. Our fourth component is really cool and nobody else has this. This is a standout feature. If you have a family member or a friend providing care, so a family caregiver, and they're providing, an hour a day of help, they can go to TCare's website. TCare is a company that only works with family caregivers to make sure that they can find the resources in their area when they need them, and also so they don't get burnt out. Nothing more stressful than caring for a loved one. Included with that family caregiver care from TCare is a $3,500 benefit. So I'm going to show you a little bit of information here on that. So a family caregiver is going to help the client. They're going to go to TCare's website, do a 60 to 90 second survey, and then TCare is going to call them up. Have a 30 to 45 minute call with them. What's going on with the person who needs care? Here's what you can find in your area for care. And give us a call if you need more help or if you just need to talk to somebody. That's what TCare does. They're based in St. Louis, Missouri. Been around for 10 plus years. This is a benefit that nobody else has. So once that 30 to 45 minute phone call is done, your client will get a $3,500 check that they can give to the family caregiver, if they like, to help offset the expenses. But if you have ever cared for a family member or friend when it comes to this type of situation, you realize that $3,500 is really nice. But to have somebody there like TCare to be able to reach out to 24/7 when you need to find more care or just need somebody to talk to because you're so stressed out, I think that's even more valuable of a benefit. So in a nutshell, our short-term home health care plan is amazing. One, because of that prescription drug benefit that keeps the client's net costs really low until they need that care. Two, we've got home health care benefits, home health care aid benefits, and the family caregiver benefits. And the beauty of it is it doesn't cost that much. So when we talk about this product, I also want to just open it up to the fact that you can talk to most of your clients, 55 to 85, about this plan. They don't have to be just Medicare Advantage. Even your folks on Medicare A and B with MedSup, still going to be interesting to them. And if you took your phone, you don't have to do this now, but just if you just took your phone and said, what does it cost for home health care these days? Take your phone and put like $25 an hour times 24 hours in there. Get like $600, times that by 7, $4,200 a week, times 4, $18,000 a month. Your clients have probably not thought about how much money it could cost if they need a 24/7 home health care person. And also, here's something to keep in mind. Your clients may say, yeah, I've got coverage for assisted living or rehab, in my Medicare plan. And sure, you do have some. But what ends up happening when you go to a rehab facility, if you're not improving, they send you home. So every week, are they improving? There's a meeting with the doctors and the nurses. Are they improving? Yes. Okay, they can stay a little more. If they're not improving, sorry, you go home. And now you need some home health care because you're not fully healed yet, but you're just not improving anymore, so you need to go home. And that's one of the issues with the healthcare industry today, and that's one of the reasons that I found out, with my brother a year ago that, wow, this is a really big hole. So you just really don't realize how much it can cost for home health care until that situation comes about. So one, having a product like this is amazing. Two, having TCare there to help you find resources in your area is just a really amazing and stress relieving benefit. And again, only GTL has this on our short-term home health care plan. Hey, Mike, do you have anything else that you might want to add, about this product or anything like that?
A couple just general things for folks to know. We get a lot of inquiries about this. As Greg noted before, most of the states, having had this around for a while, most of the states that are going to get approved are approved. Okay, if you're in a state that isn't approved, it's not a carrier issue. Okay, it's a regulatory situation that GTL has chosen not to address. California, Washington, Florida, New York always come to mind. Washington has, and I know a lot of the agents that are on the call today are Washington agents. Washington has specific regulatory restrictions about what it considers to be short-term care and what those benefits can be, which is 90 days. And no carrier is going to spend the time and energy to go through getting a product filed with just a 90-day benefit span. So it's not even a thing. You know, you get states, and this makes no sense to me, you get states like New Mexico that doesn't have anything. Minnesota, same deal. So, I mean, most of the states where this is a possibility, they've already gone through the process. They're back with Utah. Colorado's got some funky things that they've got going on. But having that in just about 40 states is a great opportunity for us. We can't really do much about the states where it's not at. I was actually really excited to see Utah coming back because we had it for a while, and then they decided for some reason that they didn't like it. They created some issues, but GTL was able to surmount those, get the program back in place. So really, really pleased with that. And that's about all I've got. I appreciate you taking the time to go through this tremendous opportunity. Remember, folks, 90% of the people that are in your orbit in any way, shape, or form who are 55 or older have never, ever had a conversation about this. You have a product that is underwriting advantaged. You have a product that is age advantaged, goes all the way to 85, and you got a program and a product that is price advantaged. So that literally is the triple crown of opportunities that are available for you agents to use to take care of your clients. So anyway, go ahead and close her up, Greg, and we'll get these folks back to work.
Yeah, you know, the last thing I wanted to mention was a little bit of a prospecting opportunity for you guys. You know, you're wondering, well, how is everybody else prospecting with this product? You know, a lot of agents are taking advantage of these videos, especially the short-term home healthcare one. You know, they'll take the link for this video, put it on social media, maybe with a sentence or two about, you know, getting some care for down the road. That underwriting is super simple on. And also maybe an email to the clients with the video link in there, you know, with a paragraph of little information talking about the plan. But the one thing I want to mention, really important, some of you may have just got introduced to the short-term home healthcare plan today and may be thinking, this is too good to be true. This product will never last. So I can mention to you that back in 2018, when we launched our initial version, it didn't have as many benefits. And here we are 6 years later, adding a ton more benefits. So this product is working very well for both the policyholders, the agents, and GTL as the carrier. So we have never had any rate increase discussion on this plan. And I don't anticipate us having that situation at all. So this plan is working very well. If you want to ever order supplies for either product, you can call sales support at the number on your screen. You could email them at agency@gtlic.com. Please take a minute and put my name in your phone, if you will, and put my email address, gspo@gtlic.com. Feel free. You know, you get a question here or there, something comes up later in the day that you wish you would have asked, or if you're talking about this plan with a client and you get stumped, feel free to email me, whether it's during the day, evening, weekend, doesn't matter. I'm here to help. So please feel free to enjoy talking about these plans. If you need the links to the video, stuff like that, just shoot me an email. I'll get them to you real quickly. But just have fun talking about these plans. You're really going to help your clients, and it will save you from that phone call that you don't want to have, with them already finding out they have an issue and needing this type of coverage. So that's all I've got today. Hopefully we've had a little fun today and introduced you to some fun products that you will really help you, help your clients and help you commission-wise in the future.
There you go. As is always the case, our marketing team will be reaching out to you in the aftermath of this to answer questions, get you contracted. It's important to note contracting is key because compliance is key. And to be able to be out there representing this and marketing this product, you need to be appointed with GTL. We can take care of that for you. We've got a very easy process. And I can tell you that their licensing department is lightning fast with this. If you get moving on this yet today, we'll probably have you up and running by the end of the week, which means you can spend the weekend prospecting, start next week off with a bunch of sales. So as noted before, Jordan will process this recording, get it posted up to our website so you can circle back, listen to anything you want. we'll be on the phone to you to get the contracting taken care of. Materials will follow contracting, etc. And handled the few questions that we had during the course of the presentation, but there'll probably be more, and we'll take care of those when we're doing the follow-up calls. Greg, appreciate it. Good work as always. Does a great job, and we appreciate the detail and the insight into how to make this thing really work for your clients. With that, we're going to go ahead and give everybody the rest of their day back. Thanks, folks. We'll be in touch soon. Bye now.